Basically, therapy, if you think about, and we'll use trauma as an example. A trauma, by definition, is any negative event that causes someone to feel helpless or hopeless. It's outside of their normal world. And so it creates a lot of different problems emotionally, mentally, and as well as physically. These issues that people are dealing with, what we try to do in therapy is help them to find skills to cope with whatever they're dealing with, help them to find ways of navigating life through those particular issues. And so therapy it's a broad process. It's not only education, it's also helping somebody to figure out from a very practical standpoint how to move forward with whatever they're dealing with.
In 1979, UNM was starting to do gender reassignments. One of the things that got dropped out was counseling. So Ken Wells and Bernie Talley formed Counseling and Psychotherapy Institute. And since then, we've always been the last stop on the block. 25% of our clients are pro bono. We don't turn anybody away for any reason. Now, sometimes that's a problem because a lot of these people are real high risk. So our liability issues are pretty high. But that is what we were founded for, was to take care of these people that don't have any other place to go.
I've been in the world of therapy counseling for about 4 years now. Well, I'm a retired firefighter, and all of my years as a firefighter, I used to respond to a lot of different type of calls. And one of the calls that we would see frequently are individuals with different types of mental health issues. And I just started to learn a little more about it as I went along. And it became a passion of mine to reach out and help those that suffer from mental health issues. Most of the clients that I see deal from typically issues like bipolar. And bipolar is a disorder where an individual can have very extreme moods. They can go all the way from depression to mania and everything in between. I see individuals that have that are on the schizophrenia spectrum. They deal with different types of psychosis that develops out of schizophrenia. And then I deal with a lot of people that have trauma. And then a lot of other different things like depression and anxiety. Anxiety is a very big issue right now, particularly with the pandemic going on. So most people carry some anxiety with them. When the pandemic hit, they had to shut down facilities like ours. And so we did not have any personal contact with our clients. And that's a difficult thing, not only for the clients themselves that are in therapy, but also for the therapists themselves, the counselors who are interacting as well.
Neuroscience is a huge part of what we do. Meds is a huge part. I mean, you really can't do good psychotherapy without meds. But that's tough. Sometimes people come in here on 11 drugs. They need to be on one. And you can't just say, okay, we're starting over here. Just quit taking all of those and we'll give you this one, right? It doesn't work that way. It takes about usually 12 to 18 months. It's pretty uncomfortable to go through that. One of the things with psychotropic meds is adhering to the med protocol. How do you take them? When do you take them? Do you take them every day? We kind of put a wrapper around them and help the med people and the patient learn how to do the meds. They're part of our community. So we want to take care of our family, right? I started an internship in 2013 and never left. In 2015, Dr. Wells and Father Gabriel, that's Bernie Talley, we're going to shut it down. The technology was changing. The insurance companies are really difficult to deal with. You have to be on your toes all the time. It was too much for them. And they, after we had tried to find somebody to take it over, They finally decided they were just going to shut it down. And some of our patients here have been with us since 1979, and I don't know what would happen to them. We have gone through our records here. If we shut down, we think we would probably have close to 50 suicides. I mean, this is pretty serious stuff we do here.
One of the things that I think is just so important is that an individual who is suffering from different issues, that they find the therapist that works for them. I can't help everybody. I'm not suited for everybody. My personality might not work with everybody, probably doesn't. And so it's really important for an individual to find the right therapist for them.
Dr. Wells, right before he died, I gave him my word it would remain the same that it's always been. It needed to stay like it was. There's no place in the city like this. I mean, we take the roughest of the roughest cases. Heavy trauma, personality disorders, DID, dissociative identity disorders, pretty standard fare for us. All of the hard ones, the ones that a lot of counselors don't want to mess with, and a lot of businesses don't because there's a lot of professional liability. You know, these people are ill. This is our community, and we're going to take care of it. Well, if you don't have mental health, you don't have anything else, do you? And one of the things I'd like to leave whoever watches this is that counseling and psychotherapy and all these things we do are about mental health, not mental illness. Mental illness is because you don't have the right meds, you don't have the right therapy, you haven't dealt with the traumas, all that stuff. What we do is mental health. Just like you go to the doctor for a physical, see if everything's good, we encourage our patients, clients, whatever you want to call them, to check back in every 90 days or a year, 6 months, see how you're doing, so that you can catch stuff before it gets to be a problem.